blankets of smoke, a hazy skyline. This has been the scene in Thunder Bay on and off for weeks. On smoky days for Gail Hebert-Miller, just being outside is a health risk.
You're constantly with an inhaler, no matter where you are, you've got them everywhere. I have them at home, at camp, at work, in my vehicles. But it's just so hard to breathe.
Smoke triggers her asthma. It's why she wears her mask even to walk a short distance.
As soon as I open that door, I can smell the smoke. I don't go out. It's like we stay indoors.
Wildfire season means few daily walks with her dogs, keeping the windows and doors closed at all times and constantly monitoring the air quality. Her puffers and asthma medications run her nearly $1,000 a month, but she can't do without them.
It's very hard to catch your breath. It's like somebody's sitting on your chest all the time.
Ongoing wildfires in northern Ontario have prompted poor air quality alerts across the province. On this day in Thunder Bay, the air quality is at a moderate risk, but if the wind changes direction, who knows? Respirologist Dr. Barubi Beeman runs a weekly asthma clinic in the city.
We are seeing more of the severe asthmatics right now. A lot of them, many of them in fact, are not well controlled.
Most of her patients have had to increase their medications and stay home. Dr. Beeman is concerned about what lies ahead.
It's anticipated it's going to get worse, and if it does, we're going to see increasing healthcare costs, increasing costs of the impact on the community, ability to work, ability to provide services, and I think this is all, sort of a perfect storm right now.
Across Canada, wildfires this season have displaced thousands of people, decimated whole communities, and impacted air quality from coast to coast. While being outside has been a safe place during this pandemic, on days when air quality is poor, Health Canada recommends limiting outdoor activity, keeping windows and doors closed, and if possible, using an air filter at home. Wildfire smoke is a mix of gases and tiny particles produced when organic materials burn, and the long-term health effects of exposure are mostly unknown.
Those very small particles can reach deep into your lungs, and they can cause irritation and inflammation.
Sarah Henderson, a scientific director of environmental health for the BC Centre for Disease Control, is trying to find answers.
They are a foreign invader the same way that a bacterium or a virus would be a foreign invader, and your body treats them the same way, but it can't kill them because they're not alive.
Henderson has 2 long-term studies underway. One that examines infants exposed to smoke during BC's 2017 and 2018 wildfire seasons, and another that examines the impact in people with underlying health conditions, such as heart or lung disease.
We have particular concern about infants who are exposed in utero and infants who are exposed very early in their lives. There's the potential for these big and significant wildfire smoke exposures to affect the health of those individuals throughout their lives.
There's also the impact on health systems. A recent study looking at Yellowknife's 2014 wildfire season showed just how big of an impact.
We had increased presentations for pneumonia. We had about double the emergency department visits for asthma over the course of our 2.5-month smoke exposures.
Emergency physician Dr. Courtney Howard says she's most concerned about how climate change will continue to exacerbate the issue of wildfires.
Continued warming already has impact and is going to continue to warm through to at least mid-century. So we have to move this reality of warming into our common vision of the future so we can make the best plans to prepare.
Only halfway through the wildfire season, hundreds of fires are currently burning across Canada. Tashana Reid, CBC News, Toronto.